Hi. So this is the fourth part of papillary thyroid carcinoma. Here I am going to detail about iodine scintigraphy and radioactive iodine ablation. So why are we doing iodine scintigraphy in the first place? See, post-operatively, that is operation that total thyroidectomy or near total thyroidectomy has been done. Now we want to find out whether any thyroid tissue has been left behind or not. Why? Even that thyroid tissue has to be removed. Not surgically, but we can take it off, we can burn it off with radioactive iodine. So first we have to find out whether it is there or not. For that we'll do iodine scintigraphy. So the preparation for iodine scintigraphy I have already mentioned in the previous video. Please do watch that. So this is done as an OPD procedure, and it is usually done in the regional cancer center at a higher level or any private hospital which those who have all these facilities. So when you go to the doctor, when you are referred to the next center, you are supposed to take a few documents with you. This is specifically for India. Here I am telling you, you are supposed to take your discharge summary and your biopsy report, a copy of that, and the specimen, biopsy specimen, along with that your proof, address proof. These are things which they need, and they are going to ask you a few things. The first question will be, are you taking L-throxine? The answer is going to be no. I have stopped it for the last 4 to 6 weeks. The next question will be, have you got any of these signs? Have you put on weight? Have your appetite come down? Have your face become round? Are you getting irritated? So they want to know whether all these, the side effects of withdrawal is there or not. So you will be saying yes to all. 2. The next thing will be, have you taken anything of these? And they will read it out. Milk product, seafoods, steroids, vitamins, which I have already mentioned in the previous video. So the answer is going to be no, because all this your doctor has already mentioned not to take. So they'll do a simple T3, T4, TSH, where the TSH will be very high. So it's confirmed you don't have much of iodine in your body. So they can proceed the procedure and they'll give a date. The nearest possible date for iodine scintigraphy will be given to you. So as mentioned, it's going to an OPD procedure. Here, when you go on that particular date, you will be asked to drink that radioactive iodine material, which is in a low dose. And after a particular time period, they place gamma camera in front of the neck, and they want to know the exposure, the amount of thyroid, if any, if it is there in the neck or not. If it comes negative, the treatment stops here. It's fine. You will be on regular follow-up. If it is positive, it will give an amount, how much of iodine has been accumulated and how much of tissue is left behind. We have an idea. So this needs treatment. Now, before going to the treatment, let me tell you what I have been given is radioactive iodine. So radioactive material. So when you travel, it's an outpatient procedure, so you're going to go back home the same day. So when you go back home, you're not supposed to travel in a public transport. You have to go back in your own vehicle, and the co-passengers will be seated, at least should be away from you, because you have taken radioactive iodine, which is being emitted from your body. The other normal person may get affected. And you have to drink as much water as possible. And when you reach home, you have a separate room for next 2-3 days. And in that room with this bath attached, all the food will be provided to you in that room. And after eating, you have to yourself clean the utensils, everything, and keep it in a room. Only during the next food service you are going to give the utensils. So in short, the material which you are using should not be shared with others. And nobody should be allowed to visit you in the room. They should be away from you for this during this waiting period. Especially so children and pregnant ladies, because the radiation emission from your body can affect them faster. You should, by no reason, you should be in close contact with your husband. and when you go use your restroom, you have to flush out at least 2-3 times so that it doesn't stay there. Please do not bite your nail. Whatever objects or necklace, everything which you remove, please keep it in your room itself. Any material to be, any dress to be washed, you have to do it in your room only, not with a general lot. So these are the general precautions, and not only that, since the radioactive iodine can get accumulated in the salivary glands, there will be pain in the neck. So you have to flush out from the salivary gland. So what you take sips of lemon juice. So that will flush out from the salivary gland, the pain will come down. And take as much of water as possible, more of salads, vegetable food, avoid oily foods. These are the usual precautions which has to be taken when you come back home after this iodine scintigraphy. This is what I have mentioned. Now, the outcome also I have told you. Suppose it has come positive, the next will be the whatever iodine is there, we have to burn it out. That is radioablation. So you will be given an appointment, and this time it is going to be admission for 2-3 days. I'll tell you the reason for that. So when you go on that particular date, you will be admitted, and they'll give you radioactive iodine in a much higher dose, because we have to burn out, not find out. So when this works, more of radiation emission will be in the body, and sure, there will be more of side effects also. You'll become tired. Already there is loss of appetite, weight gain, so many other things, because you have stopped your L-toxin. You become more tired, increased muscle pain, general weakness is more, irritability is increased, and you start vomiting because of side effect. And it can affect your bone marrow and result in low blood count. If it is so, when the doctor finds it out, they replace blood, transfuse blood, or the platelet is less, the platelet has to be transfused. These are the side effects, and the IV fluids will be going on. If necessary, they'll add up antibiotic. This is how we deal with the procedure. Now, by 2-3 days when you are fine, your general condition is fine, your treatment is over. You can go back home again, like how you followed the first one. There you have, it was less dose of radioactive iodine, your precautions. Now it is much higher dose, the duration is going to be the same for precaution. So again, you have to go back in a private vehicle, not in public transport. At home, you are going to be in the same room, alone, avoiding others. And you are going to take care of yourself, all your things you are going to take care of yourself till the time specified by your treating doctor, usually 2-3 days. So that completes a treatment for papillary carcinoma thyroid. Now they tell you to start tablet L-toxin. So at least 8 to 9 companies, they produce L-toxin, that's T4 tablets. It starts from 12.5, it goes up to 150 to 200 micrograms. And what is required for a patient of total thyroidectomy? Minimal dose of usually 150 micrograms, which will be asked to take in the morning. That is, as soon as you get up and brush your teeth, you have to take this tablet, and followed by you have to be nil per hourly at least for 1 hour, so that it will enhance the absorption completely. This has to be done daily, lifelong, along with calcium and vitamin D and maybe corticosteroid. This will go on regularly, and you will be regular checkup with your local doctor for serum calcium and thyroid hormone, which it has L-toxin tablet adjustment with your local doctor, the surgeon who is operated on you, and you will have to be a long-term follow-up, say every 3 months or 6 months follow-up with your regional cancer center doctor. There, when you go, you have to show all these reports, and they will ask you to do serum thyroglobulin blood report. When it is normal, they'll say fine. They'll examine the neck and they'll say if they doubt something, maximum they'll do an ultrasound, and same day you can be back home. If it's home is not very far off, you can be on same day, you can be back home. So This video I have covered iodine scintigraphy and radioactive ablation. With that, we come to an end of treatment part of papillary thyroid carcinoma. Now, the last part about recurrence. Please do watch that. Thank you so much.